This is Tan, a 20-year-old who enjoys playing badminton as a hobby and plays it for at least 2 to 3 times a week. Recently, Tan has been experiencing a discomfort in his right shoulder but doesn't seem to care much about it. Let's understand the situation better. Here's Tan playing badminton from a side view. There are 5 phases in the kinesiology of an overhand movement: wind up, cocking, acceleration, release, and follow through. Let's zoom in to further analyze the way he delivers his moves. Wind up requires putting the entire body into the best position to generate force, while the cocking stage involves pulling the throwing arm into an abducted and externally rotated position at the GH joint. Next, the acceleration involves a sudden reverse of cocking, and the release follows after. Strains to the rotator cuff occur during the follow-through, during the eccentric phase of contraction. Risk of injury increases when muscles of rotator cuff are weaker than others involved in the acceleration phase. Now back to Tan. Due to the overuse during badminton smashing, strains to the rotator cuff can occur. What's more, errors in execution of smash contribute to overuse injury, leading to rotator cuff tendonitis. To understand this better, let's zoom into his right shoulder. The rotator cuff is a group of muscles and tendons that attach to the bones of shoulder joint, allowing the shoulder to move and keep it stable. Rotator cuff tendonitis refers to irritation of these tendons and inflammation of bursa lining these tendons. In the cocking phase, the shoulder externally rotates and the humeral head translates anteriorly as the smasher body moves forward. This inertial force on the arm creates further external rotation. In a high-speed smash, the inertial force is greater, therefore greater force is placed on the external rotation. During the over-rotation, the posterior rotator cuff becomes impinged between the glenoid labrum and humeral head. Long-term, causes the degeneration of the rotator cuff tendons. During deceleration, the rotator cuff muscles are active to resist the distraction force at the shoulder, placing a large tensile force on the muscles. Tensile failure can occur in the supraspinatus tendon while these muscles try to decelerate arm and elbow. Following through on the racket side only, this is the opposite extreme where the whole follow through is only in the racket side of the body. This forces the arm into an extreme position. Hitting like this has a high risk of injury to the shoulder or elbow. It's caused by the player trying to force power rather than using a proper overhead throwing action. Repeated rotator cuff injury from straining or pinching the rotator cuff tendons will injure the soft tissues, resulting in bruising or swelling. Most tears are the result of a wearing down of the tendon that occurs slowly over time. Repeating the same shoulder motion again and again can stretch your rotator cuff muscles and tendons. Now, let's look at how the proper technique is carried out. When you smash, take a step forward, aim to hit the shuttlecock at the highest point you can comfortably, so your arm and racket should be fully extended at the point of impact. Your muscles should be loose at the point of impact, and don't try to hit the shuttlecock hard. Doing so will only cause your muscles to tighten. Lead the motion with your non-racket arm and step forward and swing your forearm forward at the same time. Before impact, you should flick your wrist and point of impact should be slightly in front of you. Keep your arm and racket outstretched so that you hit the shuttlecock as high in the air as possible without your arm being hyperextended. There should still be a slight bend in your elbow to avoid the probability of injury. After you hit the shuttlecock, your racket should continue downwards as if it had just hit through the shuttlecock and is continuing its trajectory. Good follow-through maintains your racket speed as you hit the shuttlecock so that you put the maximum force into the impact. You should be hitting through the shuttlecock.
Acute rotator cuff tendonitis. Apply the RICE method. Rest and refrain from doing exercise that causes pain to the injured side. Ice the injured side for 10 to 20 minutes, 3 or more times a day. Compressed shoulder joint muscles, tendons and ligaments helps to increase blood flow, promoting recovery. Compression can be done by wearing an elastic bandage or shoulder braces. Elevate the injured or sore area on pillows while applying ice and anytime while you're sitting or lying down. To reduce the acute occurrence of rotator cuff tendonitis, warm-up and stretching plays an important role. Warm-up and stretching gently prepares the body for vigorous exercise by gradually increasing heart rate and blood circulation to the muscles. These are the equipments needed. Warm up the rotator cuff muscles by rotating the arms in and out. This will loosen the joints and increase blood flow to the muscles. To perform internal rotator cuff stretch, reach the arms out to shoulder height and bend the elbows 90 degrees, exhaling to rotate the arms out, which will stretch the internal rotators. Keep elbows lifted to shoulder height or slightly lower, and focus on upper arm rotation. To perform external rotator cuff stretch, keep elbows at shoulder height and rotate upper arm bone in and exhale while rotating the arms in. This exercise stretches external rotators. To perform the supraspinator stretch, place the back of one hand on the waist with the elbows pointing out. Assist with the opposite hand by manually rotating the humerus, which is the upper arm bone, forward and exhale. For the front shoulder stretch, place hand or forearm against a fixed point with the elbow and shoulder at about 90 degrees. Gently turn your body away to stretch the front of the shoulder and chest. You should feel a gentle stretch in the front of the shoulder. As for the posterior shoulder stretch, place one arm across your chest and pull it in tight with the other. You should feel a gentle stretch at the back of the shoulder. These are the general stretching tips. First is to have a gentle, slow and controlled motion at all times. Relax the entire body, never go past beyond the point of serious discomfort or pain. Breathe slowly and deeply as you stretch. Never hold your breath as you perform stretching movement. Avoid ballistic stretching, and lastly, always perform stretches after warming up. When a tear occurs, surrounding soft tissue around the joint sustains damage as well. This result is muscular atrophy and a decreased range of motion. Recovery exercise aim to strengthen and restore the shoulder joint to the original range of motion. One of the supine rotator cuff exercise is called the Codman's exercise. To perform this exercise, first lie on your back and use your uninvolved hand to assist your other arm to vertical position facing the ceiling. Start by actively moving your arm across your chest and out to the side, gradually increasing the range of motion over time. You can transition to move your arm towards your head and hip as well as in circumduction movement, performing both anti-clockwise and clockwise movement. Strengthening the major muscle groups around the affected shoulder joint is a crucial part of rehabilitation and prevents reoccurrence of the injury. Strength training combats muscular atrophy due to injury and helps stabilize the injured joint. To perform internal or external rotation, keep your elbows close to your body and rotate your hand outwards. If you are doing external rotation, bring your hand towards your belly for internal rotation, performing the movement slowly and with control. To perform teraband rolling, sit or stand upright with your back straight. When doing the exercise, keep your elbows close to the side of your body and initiate the pull leading with your elbow. Throughout the exercise, keep your shoulders relaxed and avoid struggling at the shoulders. To perform wall push-up, stand facing a wall, feet and arms approximately shoulder width apart. Place your palm flat against the wall. When doing the push-up, avoid flaring the elbows and perform the exercise in a slow and controlled manner. Do not allow shoulders to shrug. To perform shoulder pendulum exercise, place one hand on the thigh and the other with the weight. Relax your arm and let it hang down. Move your arm in circumduction movement, such as anti-clockwise and clockwise, as well as front and back motion. Scapular stabilization exercise strengthen the shoulder girdle muscles to help restore normal scapular movement. The main muscles which are targeted by this exercise include the trapezius and the serratus anterior. Strengthening these muscles provide greater support to the scapula. To perform scapular retraction, squeeze your shoulder blades together, bring it back and down. Imagine trying to pinch a band with your shoulder blades. To perform scapular depression, squeeze your shoulder blade down and focus on bringing your arm towards your body. To perform shoulder shrug, hold a weight or with a resistant band. Shrug your shoulder upwards, bringing your shoulder towards your ears. These are the summary of the exercises we have covered so far.
Now that my injury has healed, I can play!